He presented to us 1.5 years back. 1.5 years back he presented to us with ulcerative growth on the forehead, the left side.
Interesting case.
So H biopsy showed invasive carcinoma, coily basal cell carcinoma. Then we planned wide local excision of the right side along with the
and this was discussed in CPC also, if you remember. We discussed it in CPC with you, and we did a wide local excision and a forehead with this transpositional.
Then he presented to us with another ulcerative growth on the right side, and again the wide local excision with MRND was done on the right side. Along with the transposition flap reconstruction. The first report which we got was basal cell carcinoma with and another lymph node was positive, the pre-auricular lymph node which showed metastatic deposit. In another surgery, the report which we got was squamous cell carcinoma with lymph node metastasis.
That's now.
Yes, that's now.
Another job. Stage twice it came, we were given because first of all in the very first report I was concerned because lymph node involvement is not common with basal cell carcinoma. So I had to do a neck dissection and nodes were positive. They still reported it as basal cell. So I told them, are you sure it is basal? But there are basosquamous types, the squamous variety of basal, etc. I thought maybe nodes have got involved because the differentiation is gone.
That can metastasise.
That basosquamous can. Came with the other side. Now, in the last CPC, Charanjit was telling me, sir, it is actually squamous cell carcinoma. And it's got multiple lesions all over the head and neck. We removed all of them and he's come with another one.
Squamous cell, multiple.
Yeah.
Skin का है सर, skin है ना ये skin का है बस. Multiple tumors. And you तो कहीं लग रहा है सर picture में लगी.
Microscopy will be very different from SCC. Totally different.
What is the difference?
Even what report was keratitis also. That converted to carcinoma.
They are not showing it properly. Hetu, on the left, just stay there. You keep it where you are keeping. Keep your left hand free. And this was on the left side was basal cell carcinoma. On the right side was actinic keratitis.
Okay, right side.
We did not do anything that time. Because actinic keratitis, precancerous, all right, but we just need to shave off. So we shaved it off. And it came out fine. Same place he has developed a squamous.
On the same side.
So it's a seed and soil variola concept. And this is a soil which is completely gone.
Fertile soil.
Fertile soil. And that too, poor fellow has albino. But there are multiple such spots.
It must be UV related, sir. Ultraviolet related. Because it's on the
It is
exposed
ultraviolet.
sides and melanin pigment is protective against
Anything
UV.
extra
So that
that
is
you
the
need to
thing
do.
I think
People do
is the
lot of
cause
reading.
here.
Yeah. To find out some kind of a syndrome, it won't fall into Buit-Ore, it will not fall into, there's a multiple neoplasia syndrome, another one, where they find skin, multiple, the skin itself is diseased to multiple lesions. Can we do some work up? Or is it something worth population to start discussing?
So in fact, I had one case few months back. He also had multiple SCCs, but that was exact opposite to this. That was the non-sun exposed areas. Means in
That would be
the
very
leg,
But
foot.
you know, Dr. Kataria
That
made
came
a
from
point
other
which
unit.
is based on wisdom and experience. Multiple squamous cell carcinomas, even in a damaged skin, are not common.
It's very unusual.
Even following radiation and ultraviolet, they mostly get angios.
Because you see two or three.
They are known to happen. It's not common.
Hey, angiosarcoma, I'm saying because I've seen
That's
couple of cases like this. You
And
get
that
like
was saying
written
it is
the
non-sun
excisions and
exposed.
they are actually initial reports were seborrheic dermatitis.
There you are. In one case it was actinic keratitis, seborrheic dermatitis. Actinic keratitis is almost just a stage before cancer.
But the shade is supposed to be good enough.
Any genetic workup to be done, Dr. Amit? That's why I'm asking. I was coming to that. Genetic? No?
तो सारे स्क्वेमस टाइप से आए मतलब बेसल या स्क्वेमस
How many times you have seen multiple squamous in the head and neck?
Sir, I have seen metastasis.
See again, a huge amount of experience in front of
Metastasis.
you. They have not seen it commonly, so it's something worth writing and reporting. You get the point? And you got the inputs from the MDT. What should be done? We'll keep excising. That's all you can do. You have no choice.
Chasing the disease ही possible है sir, या तो फिर छोड़ दो, let it go.
How about radiation in this case? Your views on post ultraviolet exposed
आपने
radiation
हर
cancer?
बारी सारे के सारे R0 ही रखे हैं,
R0.
R0 रखे हैं, ये
This is a place
albino है.
where they talk about Mohs micrographic surgery also because
हाँ.
you want to excise limited. So this is that area. You want to do less of damage. Yeah.
Sir, ये albino है, they respond very poorly with radiation.
Glad you said that. Because you know they're all listening. It's an information which is going in. Most albinos are those with lack of pigment in the skin. They respond poorly to radiation. So they're not very good candidates for radiation. Can radiation induce cancer?
Sir, yes, in a few cases, but that is very rare, very rare.
Especially in albinos.
Albinos पे सर ऐसा कोई अलग से कोई इतना
There's a
sample
high
size
possibility.
है.
High possibility.
The high
Second malignancy
possibility.
is
Second
common.
malignancy is common. So maybe we would falter by giving radiation. But I am asking
Ma'am,
basically
so
about
sir,
treatment.
we would like to avoid radiation in these kind of cases.
Precisely. Reason being, you can get a second cancer, and third, it's not very effective. Right?
Yes, sir.
The indications also not there. R0 resection.
R0 resection.
So
The
there's no need for
node
radiation.
are positive. Neck nodes.
Neck noise.
Can we give-
That was indication.
Next
First
को
one.
address कर सकते थे, लेकिन सर फिर
Give an MRND type 3 on the left side because they were
But
not.
then you can give.
Then we can give it.
सर सबसे बड़ी प्रॉब्लम क्या होती है, चलो डाल भी दिया रेडिएशन पे, they react very fast and very severely. तो इनकी जो स्किन रिएक्शन
Radiation dermatitis of
बहुत सिवियर आते हैं, तो इनमें ना स्किन ब्रेकडाउन वगैरह बहुत कॉमन होता है. फिर आपकी रेडिएशन जो होती है फिर वो इंटरप्ट होती है तो फिर यू डोंट नो कि वो कहाँ जा रहा है, मतलब अब कितनी इफेक्टिव डोज बन रही है. आपने टोटल डोज तो कर दी पूरी, पर वो हफ्ते 10 दिन इंटरप्ट करके
Practical point.
यू डोंट नो वेयर यू हैव टेकन द पेशेंट. तो वो तो एक तरह से रिचुअल हो गया कि आपने पूरी तो कर दी रेडिएशन, बट एक्चुअली में थेरेप्यूटिक इफेक्ट क्या आया, नोबडी नोज इन द वर्ल्ड. So
Sir, in the second surgery, neck nodes, out of 14 nodes, only 1 node showed tumor deposit. And the first- that was the first surgery, only pre-auricular node showed tumor deposit.
Second surgery neck node.
Second surgery done on the right side.
Now what do you want? What answer do you want from the MDT?
So, wanted to ask about the
Any role for
radiation. They
chemo?
already had
In this
chemo.
case, any role for chemo?
If we are avoiding radiation, can we give chemo? What chemo would you like to do?
Squamous cell, paclitaxel 5. Cisplatin therapy or paclicarbo?
Cisplatin based chemotherapy.
I
with
think
taxane
program will be
therapy.
doublet platinum based doublet. वो उसमें फिर
Platinum
वो
based
choices है,
doublet would be
choices क्या करने हैं वो आप वो कर दे सकते हैं.
Cisplatin therapy or paclitaxel.
any more questions, sir? You are happy? Summarize it quickly.
So the
All
decision
the
of
5
the
cases.
now
So that you repeat all